Hello, and welcome to Environmental Exposures in Veterans with Parkinson's. I'm Melody McLaughlin, Senior Community Program Manager for the New England and the Mid-Atlantic chapter of the Parkinson'S Foundation. I'm so thrilled to be joining you today, along with our guests, Dr. Anna Hohler and Dr. Okeanis Vaou of St. Elizabeth's Medical Center, as well as Gretchen Glenn of the Philadelphia Parkinson's Disease Research, Education, and Clinical Center. We're most grateful for this opportunity to reach veterans with Parkinson's disease, as well as their care partners and families. We would like to start today's program by playing the national anthem performed by the Parkinson'S Choir. The Parkinson'S Choir is a Parkinson's Foundation community grant program led by JFK Johnson Rehabilitation Institute. The spectacular choir is made up of people with Parkinson's disease and Parkinson plus syndromes, as well as veterans who are part of the choir. Bravo, and thank you to the Parkinson'S Choir for kicking us off here today. We are so excited to have nearly 1,400 people registered from all over the United States and abroad, including Canada, Finland, Spain, and beyond. So welcome, everyone. Now I'd like to share a bit about the Parkinson'S Foundation. And before I do, just a reminder that while you're most welcome to take notes, feel free to sit back and focus on the webinar because you will receive an email from us in about a week with the slides and a link to this webinar recording. So without further ado, we are the nation's leading community for people with Parkinson's disease, the people who love them, and all of those who are working to end the disease. It's with our presence in communities around the globe that we believe in the promise of a cure and a better life today for those impacted by Parkinson's. The urgency of our mission really does translate into what we do. To achieve our mission, we pursue three goals. One, ensuring better care for everyone for today. Two, understanding Parkinson's through research for tomorrow. And three, educating and empowering the Parkinson's community for us all. We provide free resources, including a very extensive collection of fact sheets, podcasts, and books, including our newly diagnosed kit that can be found in our PD library, webinars like today's special program, as well as our weekly virtual programming, PD Health at Home, our life-saving hospital safety kit called Aware and Care, and of course, our toll-free helpline, 1-800-4PD-INFO, which is staffed by Parkinson's specialists. We also support the Parkinson's community through investing in Parkinson's research, what causes it, how to treat it, and ultimately how to cure it. PD Generation is a national initiative that offers genetic testing and counseling at no cost for people with Parkinson's. You can participate in person or through an at-home testing kit. To learn more, visit parkinson.org/PDGeneration. And the Parkinson's Foundation is truly committed in reaching every person living with Parkinson's, and a critical way we do that is through our partnerships. With more than 110,000 veterans living with Parkinson's disease, the Foundation is proud to have established a national partnership with the U.S. Department of Veterans Affairs. The ultimate goal of this partnership is to improve the quality of life for veterans living with PD and their care partners through greater access to education, resources, and support. The Parkinson's Foundation is working with the VA on a national, regional, local, and community level to develop and build on relationships with the 6 VA PADRECs across the country and the 51 VA consortium centers. I'd like to especially highlight our newly developed FAQ guide for Parkinson's. Their loved ones, their care partners, this guide really provides a great overview of Parkinson's disease, as well as VA resources, benefits, eligibility, and access to care. You can learn more and access this guide and other resources at parkinson.org/veterans. And with all that, I am now thrilled to introduce today's speakers, Dr. Okeanis Vaou and Dr. Anna Hohler. We'll also be joined by social worker and associate director of education for the Philadelphia Pediatric, Gretchen Glenn. She'll be introduced ahead of our Q&A session. Dr. Hohler joined St. Elizabeth's Medical Center in November of 2017 as the first female chair of neurology. She is a professor of neurology at Tufts University School of Medicine and adjunct professor of neurology at Boston University School of Medicine. Dr. Hohler also served as the founding director of the Boston University Center for Military and Post-Deployment Health. Dr. Hohler completed her undergraduate and her medical degree at Boston University and her internship and residency in neurology at Madigan Army Medical Center. After 8 years of distinguished military service in the U.S. Army, where she served as the neurology residency program director and the neurology clinic chief, she was honorably discharged, having achieved the rank of major. During her long career, Dr. Hohler has cared for active duty and retired neurology patients, patients in the VA system, and veterans receiving care in the community. Also joining us is Dr. Okeanis Vaou. Dr. Vaou is the director of the Movement Disorders and Deep Brain Stimulation Center at St. Elizabeth's Medical Center. Her expertise is treating patients with Parkinson's disease and other movement disorders. She's also a board-certified sleep specialist and treats sleep disorders in patients with movement disorders. Dr. Vaou is actively involved in medical student education and serves as the Neurology Medical Student Clerkship Director at Tufts Medical School and oversees the BU School of Medicine Medical Student Education, as well as the PA student program at St. Elizabeth's. Dr. Vaou is also involved in researching environmental exposures and the role of developing Parkinson's disease and inpatient education in Parkinson's disease. Dr. Vaou also cares for veterans receiving care in the community. She has participated in specific programming for veterans with Parkinson's provided in the yearly St. Elizabeth's Medical Center's Veterans Symposium. Please join me in welcoming today's speakers, Dr. Hohler and Dr. Vaou.
Good afternoon, everyone. Thank you so much for joining us. We will be talking about environmental exposures in veterans with Parkinson's disease. More specifically, we will discuss how military exposure can increase risk to Parkinson's disease. We'll talk about the impact of toxins and head trauma in the development of Parkinson's disease. And last, highlight all the resources for veterans with Parkinson's and care partners that are available through Parkinson's disease and Parkinson's Foundation. What is Parkinson's disease? Parkinson's disease is a progressive neurological disorder that occurs when the cells in the brain that make dopamine start to perish. The rate of progression and symptoms are very different from everyone. There's the motor symptoms, which include resting tremors, slowness of movements, and problems with balance and walking. And there's also the non-motor symptoms, which include low blood pressure, depression, anxiety, problems with sleep, memory, constipation, etc. Now, what is Parkinsonism? Parkinson's is an umbrella term used to describe the collection of symptoms and signs of Parkinson's disease, as well as related disorders that may look like Parkinson's disease. These symptoms include slowness, stiffness, tremors, as well as problems with balance and walking. What causes Parkinson's disease? Well, the exact cause of Parkinson's disease is not known. However, we know that it is linked to genetic and also environmental factors. In addition, some veterans developing Parkinson's disease can be associated with exposure to Agent Orange or other herbicides during their military service. Veterans with Parkinson's who were exposed to certain herbicides during their service may be eligible for disability compensation and healthcare. Now, is there genetic testing for Parkinson's? While there is no genetic test to diagnose Parkinson's disease, there are tests that determine whether one carries a specific Parkinson's gene mutation. Parkinson Foundation has started an initiative called PD Generation, which is mapping the future of Parkinson's disease to offer genetic testing for clinically relevant Parkinson's-related genes and also offer genetic counseling at no cost for people with Parkinson's disease. If you're interested in participating in this genetic testing and counseling, you may visit parkinsons.org/PD generation. What is the incidence of Parkinson's disease in veterans? We do know that there are approximately 10 million people worldwide and 1 million in the United States living with Parkinson's disease. Out of those, the VA estimates that about 110,000 veterans have Parkinson's disease. And most people with Parkinson's develop symptoms at 50 years or older. This number is expected to rise as our population ages, and so will the number of veterans diagnosed with Parkinson's disease. And while living with Parkinson's can be challenging, an earlier diagnosis or an early diagnosis and beginning of treatment can help people live better with Parkinson's and also improve their quality of life. Is Parkinson's disease a service-connected condition in the VA? We know that Parkinson's disease and Parkinsonism are presumptive conditions for veterans who were exposed to Agent Orange and certain other toxins during military service, and those veterans can apply for service-connected compensation. There's also some other exposure areas and locations that the veterans may have been exposed to risks for developing Parkinson's disease. And these are herbicide tests and storage outside Vietnam, veterans who served in the Korean demilitarized zone, Blue Water Navy veterans, Air Force and Air Force Reserve C-123 aircraft personnel, and service related to Thailand military bases. Certain exposure to other chemicals, such as solvents that contaminated water at Camp Lejeune in the past, as well as severe or moderate to severe traumatic brain injury in Gulf War veterans. From what we know, the environmental contributors, such as Agent Orange, water contamination, burn pits and fumes, and traumatic brain injury, are known contributors to Parkinson's disease. And for that, the VA provides support, and there is also a registry in place. Suspected contributors to Parkinson's disease, where additional research is needed, are toxins such as paraquat, heavy metals, welding fumes, jet fuel, trichloroethylene, and Superfund sites. What is Agent Orange? Agent Orange is a herbicide, and it's a herbicide that has two active ingredients, 2,4-D and 2,4,5-T, and both of them are contaminated or contain traces of Tcdd. Tcdd is a dioxin, and it's an unwanted byproduct of herbicide production. Dioxins are pollutants that are released into the environment by burning waste, diesel exhaust, chemical manufacturing, and other processes. Tcdd is the most toxic of all dioxins, and it's a human carcinogen classified by the Environmental Protection Agency. We know that Agent Orange dries quickly after spraying and breaks down within hours to days when exposed to sunlight and is no longer harmful. If you want more information on Tcdd, you may read the fact sheet on the chlorinated D-benzo-P-dioxins from the Agency of Toxic Substances and Disease. In some cases, a Parkinson's diagnosis can be linked to Agent Orange or other types of herbicide exposure from a veteran's military service. This powerful herbicide, Agent Orange, was used in Vietnam from 1962 to 1975 and has also been used in other locations as well. Agent Orange is a blend of herbicides that the US military sprayed from 1962 to 1971 during Operation Ranch Hand in the Vietnam War in order to remove trees and other dense tropical foliage that provided enemy cover. We know that more than 19 million gallons of various rainbow herbicide combinations were sprayed. But Agent Orange was the combination herbicide that the US military used most often. Interestingly, the name Agent Orange came from an orange identifying stripe used on the 55-gallon drums in which it was stored. Exposure to Agent Orange was also found in other locations. First of all, it was found during the Vietnam War, but also in C-123 airplanes and Agent Orange residue, as well as the Korean demilitarized zone, Thailand military bases, and herbicide tests and storage outside of Vietnam. The veterans that were exposed to Agent Orange may be eligible for a free Agent Orange registry exam, disability compensation, and other VA benefits. If you wish to learn more and if you were exposed to Agent Orange, visit the VA page on eligibility and hazardous materials or call the Agent Orange helpline at this number. We also want to bring up the water contamination at Camp Lejeune. From 1950s through the 1980s, people living or working at the US Marine Corps Base Camp Lejeune in North Carolina were potentially exposed to drinking water which was contaminated with chemicals, industrial solvents, benzene, and toxic material that was contributing to certain conditions, such as the ones listed here. Mainly cancer, but also Parkinson's disease is one of those conditions. How do people get benefits? People who had been exposed to the water contamination in Camp Lejeune, you will need to fill a claim for disability compensation and provide the evidence listed below. You need your military record showing that you served at Camp Lejeune for at least 30 days from August 1953 through December 1987, while on active duty or in the National Guard or Reserves. And you will also need medical records stating that you have one or more of those 8 illnesses that were listed in the previous slide. You can also file a claim in any of these ways online or talk to your VSO. There's also a Camp Lejeune family member program aimed at for family members of veterans who were stationed at Camp Lejeune. If you're a veteran, you can apply online or call this number for help. In August 2020, the Honoring Americans Veterans in Camp and Caring for Camp Lejeune Families Act of 2020 was signed into law. And this law requires that the VA provides healthcare to veterans who served on active duty at Camp Lejeune and to reimburse eligible Camp Lejeune family members for eligible healthcare costs related to one of those 15 specified illnesses listed here. These are mostly cancers, lung cancer, bladder cancer, miscarriage, multiple myelomas, neurobehavioral defects, etc. This is the coverage area, the map of a coverage area of Camp Lejeune that people were exposed to the contaminated drinking water. I also want to talk about the burn pits. Open air burn pits are very large areas of land that were meant to serve as mass means of waste disposal on American bases in countries like Iraq, Afghanistan, Djibouti after September 11, 2001. This practice was very effective in reducing very large quantities of waste, but Unfortunately, the pits emitted toxic smoke. The waste that has been linked to military burn pits is human waste, medical waste, ammunition, chemicals, plastic, rubber, styrofoam, all kinds of toxic chemicals, spoiled food, lubricants, petroleum, etc. As these wastes were burned, very harmful chemicals were emitted in the atmosphere, and these toxic flames were released. Veterans of Operation Enduring Freedom and Operation Iraqi Freedom have developed health conditions since from these hazardous exposures that were caused by these burn pits. Burning hazardous materials and chemicals in open air mitts. As these wastes were burned, harmful chemicals and toxins were released in the atmosphere, and veterans that were part of the Operation Enduring Freedom and Operation Iraqi Freedom have since developed health conditions from these hazardous toxic exposures that were caused by the burn pits. These toxic materials and chemicals in the open air pits are carcinogens and can cause many diseases, including Parkinson's disease and Parkinsonism. Research has shown that one of the known chemical compounds that is released by these burn pits includes the dioxin Ptsd that is also found in Agent Orange. Now, while VA acknowledges certain conditions as being eligible for presumptive service connection if the veteran can prove exposure to Agent Orange, VA has not established a presumption for veterans exposed to burn pits. And since there's no presumption, VA adjudicates burn pit claims on a case-by-case basis. So if you're interested, you may want to talk to your VSO. And now I will turn it over to Dr. Hohler to talk to you about TBI and much more on environmental exposures in Parkinson's disease.
Thank you, Dr. Vaou. I'm going to continue now talking about Parkinson's and traumatic brain injury. Among military vets, traumatic brain injury has been associated with Parkinson's disease. And some of the recent data shows that even mild traumatic brain injury has been associated with a 56% increased risk of Parkinson's disease, even after adjusting for demographics and medical psychiatric comorbidities. So what this means is that it is important in terms of understanding traumatic brain injury to help with prevention, long-term follow-up of TBI-exposed vets, and there's also a need to determine the mechanisms and modifiable risk factors for post-TBI Parkinson's disease. Eligibility for expanded benefits for traumatic brain injury depends on the severity of the traumatic brain injury, the time between the injury causing TBI and the onset of secondary illness, such as Parkinson's. However, vets should know that they should file a claim to establish direct service connection for these ailments, even if they don't meet the time and severity standards in the new regulation. And this can be done looking at the eBenefits website. So now I'm going to switch gears and talk about suspected contributors to Parkinson's disease where additional research is needed. This includes paraquat for military vets, heavy metals, welding fumes, jet fuel, trichloroethylene, and Superfund sites. Paraquat is a pesticide, and it's been associated with Parkinsonism in the general population. There haven't been a lot of studies looking directly at vets at this point, but it is something that potentially can be looked into in the future, and future research is needed. When paraquat is combined with other fungicides such as Xyram and Maneb, there is a significant increased risk, particularly in young onset Parkinson's disease. So what we learned from this study by Wang is that pesticides affecting different mechanisms can contribute to the death of dopamine cells and increase risk for Parkinson's disease. So if you think that you may have been exposed to paraquat or these other fungicides during your military history, it's important to make a note of that and discuss it with your VSO. Heavy metal toxicity has been associated with Parkinson's as well. Heavy metals, particularly manganese, copper, and mercury. For manganese, this is most commonly seen in the exposure to welding fumes. This study by Racket et al. Looked at welders in who were Midwestern workers in 2 shipyards, and they showed an increased incidence of Parkinson's in those who had a longer exposure to welding fumes. What this may mean is that those who did work with welding in shipyards or in other military capacity may have an increased risk of Parkinson's and also should discuss it with their VSO. Forever chemicals are a variety of chemicals that do not degrade and disintegrate and therefore accumulate potentially to toxic levels in our systems. There are a number of different forever chemicals, including PFOS, PFOA, and others. These have been shown over time to cause neurodegeneration of dopamine cells and can lead to Parkinson's disease. These forever chemicals can accumulate in drinking water, in soil, in water, and near waste sites, such as Superfund sites. They are found in fire extinguishing foam, particularly those of aqueous film forming foams, or AFFS. And those are used to extinguish flammable liquid-based fires. In addition, they can be found in foods such as fish and meats that are in areas with PFAS. They can also be found in food packaging, household products, personal care products, and also in biosolids. Another toxin is jet fuel. And in studies that have been done on jet fuel, there have been increased risks of toxic chemicals from the fuel that can contribute to Parkinson's. In addition, the AFFS, or fire foams that are used to extinguish jet fuel fires, can potentially increase people's exposure to carcinogens that can cause Parkinson's disease. This study looking at zebrafish did identify a direct correlation between chemicals and fuel exhaust to triggering a toxic buildup of protein in the brain called alpha-synuclein. And this is seen with people with Parkinson's disease. Trichloroethylene has also been used as a degreasing agent, and it is a significant environmental contaminant in the US. It's been implicated as a possible risk factor in the development of Parkinson's disease, and it can be seen across multiple occupational areas. It's unclear how it exactly causes dopaminergic toxicity, and more studies are being done on this. And now I want to take some time to discuss Superfund sites. Superfund sites are areas where there has been contamination by hazardous material, according to the EPA, and the EPA plans to clean up the site. There are currently 128 military installations that are on this list, and these places are contaminated with hazardous substances that can contribute to difficulties with things like Parkinsonism. A lot of these chemicals are these forever chemicals at these sites. Here is a map that shows a number of these different sites. And so you can go to the Superfund site on the EPA and identify whether or not you've had service time at any of these areas. Once you've identified any potential contributors to your Parkinson's disease, it's important to gather all of the appropriate information and bring that to your VSO. So data about the times that you spent on certain bases, data about the work that you did and whether you came in contact with any of these types of toxic chemicals. Also, if you've been in specific military areas where you may be exposed, such as to Agent Orange, to Camp Lejeune, or on any of these Superfund sites or exposure to burn pits, you want to try and give as much detail as you can about the location, the time, the duration of the exposure. Any supporting documentation from your colleagues and comrades can be useful in terms of submitting your claim. I want to just highlight that although the VA does not necessarily have funding to support all of these toxic exposures, the more claims that are submitted, the more investigation that is made into these different types of possible exposures to be able to do the research to identify the correlation. There are a variety of resources for veterans with Parkinson's disease and their care partners, including the VA website and call centers, the VA PADRACs and consortium centers, the VSO, the VA Caregiver Support Program, Community Movement Disorder Specialists, and the Parkinson's Foundation. The VA treats veterans with Parkinson's disease through the Parkinson's Disease Research, Education, and Clinical Centers and the consortium centers that offer care to all vets currently enrolled in the VA healthcare system. Developed in 2001, the PADRACs treat Parkinson's using state-of-the-art clinical care, education, research, and national outreach and advocacy. The PADRACs are staffed by internationally known movement disorder specialists, neurosurgeons, psychiatrists, psychologists, nurses, researchers, educators, social workers, and other PD experts. There are currently 6 PADRAC centers located in the VA medical centers in Philadelphia, Richmond, Houston, West Los Angeles, San Francisco, and Portland or Seattle. If you are not located close to one of these PADRACs, you can also be cared for in one of the 51 consortium centers that also offer specialized Parkinson's disease and movement disorder care. You can find where they are located at www.parkinsons.va.gov to evaluate whether or not one is close to you. Here's another piece of information about PADRACs and consortium centers. You can also find your local VSO at www.va.gov, disability, get help filing a claim, and your veteran service officer can help to guide you through the process of filing a claim to be able to get VA access and benefits. The VA has several in-home and community-based services available to support eligible veterans and their caregivers, including adult day healthcare, home-based primary care, homemaker and home health aid care, hospice care, palliative care, and respite care. You can learn more by visiting the VA's home and community-based services for geriatric and extended care. The VA also has a caregiver support program that offers many services designed specifically to support caregivers of veterans, including resources, one-on-one coaching, education, virtual support groups, and more. A caregiver can be a spouse or other family member or even a friend who's assisting the veteran on a regular basis. The Parkinson's Foundation also provides extensive caregiver resources at www.parkinsons.org/caregivers. The VA Caregiver Support Line and the website have a variety of different resources available. And they also have a support coordinator that can help in individual cases to help with caregivers to stay smart, strong, and organized for the veteran that they love. In addition, there are a number of community movement disorder specialists who care day-to-day for veterans with Parkinson's disease. I myself am one of those, as is Dr. Vaou. Our patients, who some are able to access the VA care and some of them are not eligible for VA care, we are able to provide them with the resources they need to optimize their health care with medications, surgical interventions, and if eligible for resources in the VA, to help to provide them with information to help support their claims. And we also collaborate with our local VA to be able to get access to resources for our patients. It is very common for community movement disorder specialists to collaborate with movement disorder experts in the VA. So in summary, I wanted to discuss how military exposure can increase risk of Parkinson's. I want to describe the impact of toxins on the development of Parkinson's. I wanted to outline the impact of head trauma on the development of Parkinson's disease. And we also highlighted resources for veterans with Parkinson's and care partners available through the VA and the Parkinson's Foundation. I hope everybody today was able to understand that there are many resources for vets through the military healthcare system, through the VA healthcare system, and also through the civilian healthcare system to be able to provide support and resources to optimize their care and their healthy living with Parkinson's. I want to thank you for participating in this program, and I want to thank you for your service. We'll now take questions from the audience.
Awesome. Thank you, Dr. Vaou and Dr. Hohler, for that fantastic presentation. We did receive a lot of questions from our web audience today, so I'd love to take some time now to review as many as we can. And to do that, I warmly welcome back Dr. Hohler, and I'm thrilled to introduce Gretchen Glenn. Want to make sure they pop up on our screens okay. Hi, Dr. Hohler, welcome back.
Hello.
Gretchen, welcome. Awesome. And to introduce Gretchen Glenn, Gretchen Glenn is LCSW that has served as social worker and associate director of education for the Philadelphia Parkinson's Disease Research, Education, and Clinical Center, PADRAC, since 2003. Ms. Glenn focuses her practice on adjustment to a chronic illness, supportive counseling, resource coordination, case management, and community outreach for veterans and families diagnosed with Parkinson's disease and related movement disorders. Ms. Glenn also serves as chair of the National VA Parkinson's Disease Consortium Education Subcommittee, which is responsible for providing educational opportunities to the national VA healthcare providers on the care of veterans with Parkinson's disease and related movement disorders. Welcome, Gretchen. So happy to have you here. Thanks for joining. Before we get started, Dr. Hohler and Gretchen, as I mentioned, we received a lot of great questions from our audience. And before we all respond to those, I want to take an opportunity to get to know our audience a bit more, which might help put these questions into context. So the audience should see some polling appearing on your screen, asking you to best describe what your connection to veterans and Parkinson's disease is. Awesome. I'm seeing some results trickle in. Give it a little bit more time. Just a little bit more, I think, but just about half of you have answered so far. Great. Wow. It looks like most people on this call are veterans living with Parkinson's or are a veteran. We also have a lot of healthcare professionals on the call, as well as loved ones who have a veteran with Parkinson's. So thank you so much for sharing. Again, I just wanted an opportunity to sort of get a little context for who our audience members are today. It's always important for us and our speakers to know who we're being joined by. And I do want to note too that each of you are important to us, as are your questions and concerns. And given the high volume of questions we do receive, we try our best to respond to all questions that are relevant to the topic and the broader audience. So if we aren't able to get to your question, please know that our helpline is on standby and can support you at 1-800-4PD-INFO. And with that, let's get to our first question here. Dr. Hohler, this first question is for you, and feel free, Gretchen, to chime in as well. We've got someone here, their husband is a Vietnam veteran and exposed excessively to Agent Orange and will be having DBS. How many veterans have had DBS? And although the individual results are different, how successful has DBS been for veterans exposed to Agent Orange?
It's a very good question. In terms of the specific numbers of vets who have had deep brain stimulation, I don't know that there's a number that I know in particular. And part of that is the reason is that vets can get their deep brain stimulation performed in a variety of locations. So it may be in the VA center, it may be in the community. So that data hasn't necessarily been collected as of yet that I know. Typically, patients who have Parkinson's related to Agent Orange look, in terms of their motor symptoms, like somebody who might develop Parkinson's from another reason. And as such, theoretically, they should respond to Parkinson's therapies in the same way. And that would include medication therapies and deep brain stimulation therapies. Although I am not aware of a specific study that has been done specifically evaluating patients with Agent Orange and deep brain stimulation, the theoretical answer is that it should respond, the patient should respond very well.
And sort of a tie into that question too, Dr. Hohler, is how and if any underlying PTSD might impact DBS at all.
So when patients are screened for deep brain stimulation, part of the screening includes an evaluation of their response on and off medication, and that's an indication of whether they're going to respond to the deep brain stimulation. In addition to that, there's cognitive testing that is done, and also evaluation of mood as well. And that's to determine whether or not somebody is going to be likely to respond well to the deep brain stimulation. And so if somebody has PTS, that's something that would be looked into in terms of their screening to determine whether or not things are stable and optimized before the surgical intervention.
Awesome. Thank you for answering that question. Gretchen, this next one looks like would be for you. What long-term care is available for PD veterans with service-connected 100% disability rating?
So veterans who are enrolled in VA healthcare could receive services such as home health aid, VAs have contracts with adult daycare programs in the community, respite care that can take place in the home as well as in the community. And that's the focus is on in-home type care. And if a veteran is unable to safely live at home any longer and needs nursing home level of care, they may be eligible to receive nursing home placement at one of the VA facility nursing homes called the community living centers, or most VAs have contracts with some community nursing homes that they can also contract with to be able to reside there as well. But there are specific eligibility criteria for that. So I would just recommend connecting with your social worker at your local VA to find out which services are available specifically in your area and for yourself.
Awesome, thank you. And I'll just say another plug for folks. We have plenty of time for questions, and although we have a lot, feel free to use that Q&A button on the black banner on the bottom of your screen to submit your questions. And our next question here, Dr. Hohler, are family members at risk for any side effects if the military family member was exposed or suffered effects from Agent Orange?
So I think this is a question of how is exposure ascertained? So in some cases, particularly what we learned from the Camp Lejeune evaluation is that family members who perhaps lived on the same base and had those types of water exposures could also develop different types of symptoms and problems related to the drinking water exposure. What we aren't as clear about is, I think, toxins that are impacting somebody away from home and how those might be brought back and impact individuals at home. So I think that's a great question. I think we really don't know the answer to that at this time, but it does merit some further investigation, and that's something that could be undertaken.
Awesome, thank you so much. And Gretchen, we have a few people on the line here who have asked, what resources are available in rural areas for veterans experiencing Parkinson's disease?
So we've, in the PADRACs and the consortium network, well, within the VA in general, we've been doing telemedicine for many years, even prior to the COVID-19 pandemic. So we've just been able to expand that even further and doing a lot more telehealth into the home. So if a veteran is unable to travel into a consortium or a Parkinson's, a PADRAC, and telehealth is an option as long as they have connectivity issues with the internet, that could be a possibility. We also, if a veteran is unable to come to the PADRAC or consortium center, but can get to a local VA outpatient clinic that's closer to them, we can do video visits to there as well. And there's also just founded last year was the National VA Teleneurology Program, which also has a Parkinson's and movement disorder specialist connected to that as well. That is specifically focusing on the more rural areas for our veterans. So there are options.
Thank you. Gretchen, this one is for you as well. Does the VA distinguish in terms of eligibility benefits between Parkinson's disease and Parkinsonism? Dr. Vaou had mentioned sort of the distinction between the two at the beginning of the presentation.
So initially in 2010, Parkinson's disease was classified as a presumptive service-connected condition, which meant that you didn't have to prove that your Parkinson's was related to your service time. It was just, it specifically said that if you were stationed in an area where Agent Orange was, you would be automatically, and have Parkinson's disease, you would automatically be service connected to it. Parkinsonism was just added to that list in May of this year. So that's been huge for our veterans, and it's really opened up that doorway, because as we know, it's often hard to distinguish between Parkinson's disease and Parkinsonism, and sometimes the diagnosis can change at some point. So that's been a huge benefit. We're really trying to get in touch with those veterans and outreach to them. And as Dr. Hohler said, that's why the importance of the registries are so important for our veterans to participate in those registries in case these things come up down the line. You're able to be contacted to see if you're eligible.
Awesome. Well, that is great news. Thanks for sharing that. I'm sure that's important for many people on the call today to know. Dr. Hohler, we have a question here. Are you aware of any studies related to Parkinson's and persons who served in the submarine service?
So this is another very wonderful question. There are certain areas of service where people may have been exposed to other types of exposure. So whether it's nuclear, whether there is some other type of chemical exposure that may be precise to a specific service area. These oftentimes there are fewer numbers of individuals who may have been in these regions or have been exposed to these toxins. So right now, it's a little bit harder to identify the exact correlation, but I think these types of things, it's important to get as much advocacy as we can for looking into these types of things. So in particular, I think that it behooves individuals to stay connected as much as possible with people that they served with, continue to communicate in terms of their different unit reunions and things like that. And I think that if there seems to be more individuals in these groups than in the general population or concerns about these types of things, then that's a good reason to start discussing these things. For example, with the VSO, the VSOs are often very helpful in terms of helping individuals describe what their issues are in very clear language in terms of where they serve, their exposures, and then gathering that information. And then those things are periodically reviewed. And when there's a certain number of these that bubble up, so to speak, then oftentimes an investigation is done to understand the correlation. And these are the types of things that help to determine the Agent Orange correlation, the Camp Lejeune correlation, now the investigation into the burn pits. And so what I would recommend is really starting to get the word out and talk to other individuals who may have been in a similar situation and talking to the Veterans Service and the VSO to try and get that started to see if indeed it may bear some fruit, so to speak.
Yeah, Gretchen, anything to add to that piece?
No, I agree. The Veteran Service Officers, the VSOs, are an excellent resource. They really know how to navigate through the sometimes complicated VA claim system and benefit system. So they're really there to be your advocate. I know that in the Parkinson's Foundation frequently asked question guide that everybody was given, you can find a link in there that can help you locate the VSO that's closest to you. So I would highly recommend that as well.
Awesome, thank you. And if you're looking for the FAQ guide, as Gretchen mentioned, you can visit parkinson.org/veterans. We will also share it in an email after the program in about a week. We'll move on to our next question here, and I think it's being shared in the chat. People are very quick on here. Actually, potentially for both of you, this is a really interesting question. Do either of you have a sense for what the average age is of the 110,000 veterans who have Parkinson's?
So from what we are seeing in our populations that we're studying, typically the population age is similar to what we see in the general population. So people typically have onset of their symptoms in their 60s to 70 year age. Some people have earlier onset and some people have later onset, just depending, we think, on a variety of different things, whether or not they might have some underlying genetic predisposition, how many of the environmental exposures they may have had. So in general, the population, the age of onset seems to be similar. As a result, we know more now than about Agent Orange and the exposure because of the time frame from when that exposure happened. So exposures that may have happened, in the 80s or 90s, it may take us a little bit longer to better understand the manifestation of those toxins in terms of the development of Parkinson's, because we need to get a certain amount of aging to happen and a certain number of dopamine neurons to be degenerative and to decline in order for people to start having symptoms.
Yeah. Anything
And
to add?
I agree. No, I agree.
Thank you both. Let's see, Gretchen, I have a question here for you. You've answered this a little bit already, but I think a little bit more expansion. Where can veterans with Parkinson's find help to effectively navigate through the disability benefits approval process?
So the best place to go is the veteran service officers. They're trained by the VA. They're accredited by the VA. There are some accredited lawyers as well out there. I think the important thing to know is that you should never have to pay somebody as a veteran to go through the claims process for you. Meaning there are some agencies out there that would help you, but they might charge you for that. You really want to work with an accredited veteran service officer or an accredited person who went through the process to be able to do that work specifically with the VA and has been trained and knows the system well.
Awesome. And a follow-up question to that, someone else is asking, do you find that most people have difficulty applying for VA disability benefits, or is it relatively easy? What is sort of the common theme?
I think it runs the gamut. I've seen some people whose claims have gone through fairly quickly, and I've seen others who have taken a longer period of time. I think what has been helpful over the years that I have seen is that there's a medical form called the Parkinson's Disease Disability Questionnaire that's specifically for Parkinson's, and through the VA, that if you have a neurologist, whether it be VA neurologist or outside, they can complete the Parkinson's Disease Disability Questionnaire, and it can be submitted directly to benefits in support of your service-connected claim. And I have seen that that's been helpful, even more so if it is actually done by a VA movement disorder specialist, because that, in conjunction with the medical records that they can request, it really helps to support that claim. So I can't really say for certain why some go through faster than others, but it is a process. But that's why having a VSO or working with a social worker at the VA is helpful to just help advocate for you on your behalf.
From my experience as well, if an individual with Parkinson's has a specific, for example, Agent Orange link or a Camp Lejeune link, those are more likely to go through more quickly. The ones where there might be a question, such as in things like burn pits, a case-by-case type of situation, there's no clear designated understanding of the correlation. I think that it can take some more time as well, and further documentation might be needed.
Great. Thank you both so much for that thorough answer. Really helpful. Dr. Hohler, do veterans with Parkinson's show different signs and symptoms than others who are not exposed to Agent Orange or other toxic chemicals during military service?
In the patients that we've evaluated over a number of years, there does not seem to be a difference in terms of the manifestation, the motor manifestation of Parkinson's disease in the Agent Orange patients versus those who develop their Parkinson's related to a different type of exposure or a different type of underlying issue.
And
they can look the same.
Yeah, and this might answer this next question we just received. My father is a veteran with Parkinson's. His diagnosis was in 2015, and he's advanced quite quickly. Do you see veterans with Parkinson's cases advancing more quickly than others?
I think a lot of it depends on the diagnosis. So sometimes people are diagnosed with Parkinson's disease, and as we talked about a little bit earlier, they actually have Parkinsonism. So something like progressive supranuclear palsy or multiple system atrophy or Lewy body dementia, which have Parkinsonian features, but can progress more quickly. And so that's why it's important that the VA benefits cover not just Parkinson's disease, but Parkinsonism. Typically, if somebody's progressing very rapidly in the first 5 years, it makes us think that it's probably a Parkinsonism.
Thanks, Dr. Hohler. And this next question, perhaps both of you can chime in on, what are the policies, if any, and laws banning pesticides, and how can we help stop the use of pesticides?
So I think that we learn more and more all the time about how exposure and chemicals and toxins that we utilize to make our lives easier in the day-to-day really have some long-term consequences. And as we alluded to in our discussion here today, not just consequences for us, but for the next generation as well. And in particularly these forever chemicals and these Superfund sites really highlight the fact that continued toxic exposure in our environment, in the military, and then also in the civilian world really does damage to individuals and a long-term damaging effect on our environment as a whole. So I think the best thing that we can do is really advocate for ourselves, and really, I think working together with our Parkinson's organizations and Parkinson's Foundation, I think in particular, really working on advocacy for further research into the environmental toxins that are associated with Parkinson's disease. So a lot of work is going in now into evaluating paraquat and really making that connection more clear. I think that we need to tackle forever chemicals. I think we need to tackle these Superfund sites. There are a number of different things that I mentioned, jet fuel, heavy metals, all of these things that we really need to look into further. So a lot of it starts with the research, starts with the funding, and getting together as a unified group to advocate for increased funding for these types of things, to advocate for increased funding for the VA system, to be able to care for our vets, to advocate for further funding for the PADRACs and further expansion of the PADRACs, I think is so important. And so I think by doing those things, we expand the understanding of the links, we expand the information about this, and it really propels us then to trying to do better in terms of stopping this toxic exposure. You know, there's a lot of push right now in the world venue about eliminating the use of paraquat. And I think that the more we can do to try and eliminate these types of toxins for use in the US and abroad, of course, that makes a big difference long-term to future generations as well.
Yeah, and I would just to tag on to that a little bit, you know, just to increase the types of toxins onto the presumptive service-connected conditions, so that more veterans can be able to apply for service connection, which would make you eligible for VA care if you weren't before, and also, you know, give you that additional money that you might need to help pay for care that the VA is unable to provide, just, you know, and the loss of income that might be experienced because if you're unable to work, and just the burden that it could place on family. So it's very important.
Yeah, thank you. And this question for Gretchen, sort of tying back into Dr. Hohler's point of organizations coming together to help solve these issues. Gretchen, we have someone in the audience. What are the ways are the VA, like this webinar, doing to educate veterans in the Parkinson's community, as many don't know that they may qualify for benefits? Are there any other programs, outreach initiatives they can take part in?
So we all the PADRACs participate in a lot of things within their community, getting involved in different, you know, working with the university centers of excellence, work very closely here in Philadelphia with University of Penn and Jefferson in terms of partnering with them to make them aware of the services available at the VA, so that if they have a veteran and they come across a veteran with Parkinson's in their practice that might be eligible for care, to receive the prescription benefit, the durable medical equipment that oftentimes is costly to get on your own, to be able to send them our way to get connected. I think one piece that is important that Dr. Hohler mentioned is we work together, we're not working against each other. So co-practice is something that we do often, where a veteran can come see both of us, but there's one doctor that's in charge of the care. And as long as you come to the VA once a year, you can maintain your VA benefits. Doing outreach through the community support group networks. We do a lot of that. All the PADRACs do. If you go to our website, our national website, you can find virtual support groups now that any veteran care partner or non-veteran can join to learn more about Parkinson's, as well as the VA and the consortium network. So we're trying our best, and this partnership with the Parkinson's Foundation has really helped us broaden our outreach as well. So it's been really positive.
Thanks, Gretchen. And another question to tie in that piece about the PADRACs. Someone's wondering, how do you get to go to a PADRAC? Do you need a referral from your outside doctor? I'm in the VA system, or our callers from the VA system, but not currently a patient.
So So to be eligible for care at a PADRAC or a consortium center, you do have to be eligible for VA healthcare. So you have to be enrolled in the VA healthcare system. If you are, you can either one, self-refer. You can go to our Getting Care page, which again is in the FAQ, that you can get to that website, parkinsons.va.org. And you can find a PADRAC or consortium center near you, call them directly and ask to self-refer. Or you can ask your VA primary care doctor or VA neurologist if they can put in an interfacility consult to a Parkinson's center, to one of the PADRACs or consortium centers near you. Or you can call our hotline number and we would be happy to sort of walk through that process with you and even reach out to your treating VA physician to help facilitate that consult process. And that's the 1-800-949-1001 extension 205769.
Awesome. Thank you so much for that. And I believe that's on a slide too. If you didn't take that down, you will get that. Dr. Hohler, we're going back to PTSD a bit. Have you seen whether or not there's an impact of PTSD on a PD diagnosis as it relates to military service? What do you find with that?
Yeah, so oftentimes the Parkinsonian manifestation can be complex and a lot of different things play into it. So an individual can have issues in terms of their sleep, they can have issues in terms of their cognition, they can have issues in terms of their mood, and all of that can potentially impact their Parkinson's as well. And so oftentimes, and what we recommend when people are evaluated for their Parkinson's is that there's a holistic approach that's taken. And so we evaluate not just the tremor, the stiffness, the slowness, the gait difficulties, but we also want to look at these other factors. So are people having trouble with their memory, their sleep, their autonomic system? So that's blood pressure fluctuations, constipation, things like that. Are they having issues with their mood? And our goal is to really improve all of those things. And then our patients have the best quality of life that they can. And so it's very important. And typically movement disorder physicians have this approach where we're looking at not just motor, but non-motor. And so if somebody's PTS is not well controlled, that's something that we're going to address with them. We're going to work with them. We're going to work with whatever other care providers that are helping them with that as well to try and optimize that, because we know that when their PTS is optimized, then their Parkinson's will be in a better place as well. So taking this holistic approach is so important with our Parkinson's patients in terms of having them in an improved state as much as possible.
Great.
Yeah, we're fortunate, just to piggyback on that, we're fortunate within the VA system to have a very large, comprehensive behavioral health, mental health clinics attached to the medical centers where the PADRACs and the consortium sites are. It's something that we address at every visit as well, and we can make referrals to clinicians as needed in the behavioral health line to make sure that our veterans are getting the psychiatric and psychological care that they need.
Awesome. Thank you both. This next question for Gretchen. I was on the ground in Vietnam when Agent Orange was being used, but I was not directly sprayed. Could just being there have caused my Parkinson's, and is that seen as presumptive?
Yes. So we say for any veteran who was in an area where Agent Orange, we call boots on sand, or what they call boots on sand. If you were in Vietnam territory, you should apply for service connection. If you were on the Blue Water Navy veterans, they should apply. If you were in any of the locations that are listed on the Agent Orange website of where it may have been stored or worked on any of the airplanes, I basically tell veterans, if you think that you may have been exposed or been in an area where Agent Orange was, submit a claim. They will do the investigation part of it, but you should submit a claim at least for the consideration of it.
Awesome, thank you. And just another plug for our audience members, we're going through these, so feel free to, if a question pops up, use that Q&A button and submit it, and we will get to as many as we can. Looks like this next one is for Dr. Hohler. Let's see here. This person, I spent very few days in the demilitarized zone, but I'm concerned about the South Koreans and Army personnel who might have been exposed. Can I be of any help in studies related to Parkinson's and the work in the DMZ in Korea? And how do I get involved in clinical studies?
Right. And so I think that this is a very important thing as well. So one of the things that we talk about with our patients is that the more research that we're able to conduct and the more research that individuals are able to participate in, the more questions we're able to answer. And so today we're talking mostly about environmental aspects of things. And so having exposure during one's military history to a specific area where there may be some concern about toxin exposure, just like we talked about with the nuclear subs, I think the best thing to do is to talk with your VSO about this, gather all your data, but then also to talk with your buddies as well and say, is there anybody else having any types of medical conditions, and particularly neurological conditions, and particularly is anybody having Parkinson's symptoms? And having this mentality of looking at the cohort really helps to move the science forward. So that's one piece of it. The other piece I would encourage that we didn't necessarily focus on too much today, but we just highlighted in the beginning, is the PD generation study. And I think this is very important as well. We do believe that Parkinson's is likely related in part to environment, in part to genetics. And so if we can better understand that as well and get people participating in PD generation, that also furthers our understanding of Parkinson's disease as a whole. So those would be my suggestions.
Thank you for the PD gene plug. We're really excited about that. And we actually had somebody in the audience ask a question about that. Their husband had PD gene testing done. The results were that his PD gene is not genetic, never had head trauma injury, no traumatic brain injury. We were told it was environmental. What are then the chances of being passed to their children?
Right. And so I think it depends on who else might be exposed to whatever the environmental toxin is. So these are questions in terms of, was the environmental exposure just on the military service member, or was the environmental exposure on the family? So we know, for example, with the Camp Lejeune situation, that families could be exposed, particularly if they were on base and utilizing the water and exposed in that way. And so I think that the first thing is trying to understand and tease out, if possible, what the exposure may have been, and then whether or not other family members may have been in proximity to that exposure as well.
Awesome, thank you. Gretchen, this next question, if for some reason or other the vet is not able to qualify for VA benefits, do you have other resources or information for who might be able to assist those veterans?
So if they were denied care initially.
Yep.
Yep, okay. You can talk with a social worker, you can talk with eligibility at your local VA medical center. There is, if you're non-service connected, meaning that your disability, your Parkinson's disease is not linked to your service time, or you weren't exposed to Agent Orange, there are income limits for the VA health to be eligible for VA healthcare, and it varies by location. So that could be part of the issue. If your income changes over time, if you're working when you applied and then you end up retiring, or your income takes a significant change, you should always try to reapply again, because you then may become eligible.
Awesome, thank you.
And I would just add one thing too, is that what we find with the VA is that they expand the criteria, they expand the eligibility support over time. And so you might not have qualified this year, but perhaps more research will be done in the future, and you might qualify 2 or 3 or 5 years from now. And so really keeping abreast of what the VA is covering, what they're recognizing in terms of the association, keeping tabs, reapplying if appropriate, getting further documentation. I find that sometimes it takes more than one application to get somebody their VA benefits, but I think that, you know, the more we learn, the more we explore these types of things, the more VA vets that we find are eligible for VA services. And they're so valuable.
And you can participate in any of the environmental health registry exams, whether you're eligible for VA healthcare or not, so that if one of those conditions has enough research to support that it could be related to your service, you're in that registry. And the idea then is to use that registry to outreach to those veterans to make them aware of some of the changes and that they may now be eligible for care. So that's another good reason to get connected with your VA and participate in those registry exams, because as Dr. Hohler said, they're constantly expanding eligibility for our veterans. And apply in person if you can. It's always better to apply in person at a VA medical center than doing it I feel online or by faxing or mailing, because at least you know you're handing it to a person, and you know it's getting somewhere. So if somebody's been denied, I often say, well, try again. And if you can bring it in to registration and meet with somebody physically, you might have a better chance.
Awesome. Thank you both. Really, really helpful. I know and acknowledge there are lots of various degrees of people on the call who have either not called the VA yet, have called. So I really appreciate your insights for every unique person on the call today. Let's see this next question here. We'll take a few more too. Dr. Hohler, this person's husband worked in army tank research, exposed to loud explosions from the tanks on a continuous basis. Would that affect TBI and potentially cause Parkinson's?
So great question. So this talks a little bit about head trauma now. So head trauma can be anywhere from mild to moderate to severe, and a lot of it depends on how much brain has been damaged, loss of consciousness, these types of things. And so what we know, and I talked about a little bit today, is that even mild forms of head injury can increase our risk for Parkinson's. In particular, one of the issues that's brought up here is blast injuries, and how does blast injury correlate with head injury and TBI? So there are actually some interesting studies that are being done right now, and some of them on mouse models evaluating blast and the pathologic changes that happen in the brain. And there does seem to be some specific damage that is done to the brain with blast injury. And some of it, again, has to do with proximity, the number of blasts exposed to, these types of things. I suspect that over the next 5 years, we're going to have a lot more data in terms of being able to quantify more specifically. And as we know from our more recent military engagements, the amount of blast injuries that an individual has been exposed to is really increasing, particularly with certain types of jobs and in certain types of locations. So more remains to be done in terms of research, but there's definitely correlation between traumatic brain injury and Parkinson's, and blast injury correlating to traumatic brain injury. So we'll hear more, we'll learn more about that. And I suspect the VA also will help to clarify some of this as well. But in terms of under the traumatic brain injury submission, I think that it's important to get as much documentation as possible and to work with the VSO on that as well.
And that is an area that the PADRECs are involved in with some research, is looking at the effects of TBI on our veterans. So we do expect to see some changes as that veteran population ages as well.
Exactly.
Thank you both. Gretchen, we have a question here. Have retired veterans been awarded VA disability years after they've been retired?
Yes, I would say the majority of my veterans that I work with have been been retired or out of the military for many years before they're diagnosed. And then when they come to see us is when they file for their service-connected claims. So because it's a presumptive service-connected condition, you don't have to be diagnosed. That's the whole purpose. You don't have to be diagnosed with the Parkinson's disease while serving active duty, like several of the other conditions that the VA recognizes. So definitely. So if you're retired and you developed it 20 years ago, or you retired 20 years ago and now have Parkinson's disease, and you were exposed to Agent Orange or any of the other toxins, apply for, get in touch with your veteran service officer, social worker at your VA medical center, and start your disability compensation claim.
Awesome. Thank you. Thank you. Thank you. Gretchen, this one is for you as well. Getting back to Agent Orange, how does the VA rank Agent Orange exposure levels into benefits? Even if a veteran isn't 100% disabled, I read that the VA has a ranking for the levels of Agent Orange exposure. How does that all work?
I'm not actually familiar with that. I don't work on the benefits side to know how they formulate their level of disability based on the amount of Agent Orange. I know that they look at the level of disability of the veteran, the physical disability, to come up with a rating between 0 and 100%. So, and that can increase as your symptoms and as your disease progresses. You might start out at a 50% service connected, eventually get a 50% service connected award. And then as your disease progresses, you can apply for reevaluation, and that could be increased over time.
Okay, awesome.
I don't know, Dr. Hohler, if you know anything about percentages of Agent Orange.
I haven't heard that either. And I agree with you, Gretchen. What I've seen is based on the disability of the vet. That's what the rating is related to. So I haven't heard that myself.
Thank you.
Okay, that's helpful. We had actually a few questions about ratings, so hopefully that cleared up any confusion for anyone. Really helpful. Going back to Dr. Hohler with this one, and we'll take a few more. These are just rolling in, so thank you guys for continuing to submit your questions. They're so important. Dr. Hohler, can you discuss the gene anomaly differences making you more susceptible to PD and how the VA service connection may relate to this predisposition? I guess this could be for both of you. How do you sort of determine whether it's a presumptive cause for military service versus potentially something that was predisposed or genetic?
So I think right now in the VA, there's not necessarily one excluding the other. And I think that the VA right now is looking at the environmental exposure. So as we mentioned before, the Agent Orange, the Camp Lejeune, looking at TBI, and then understanding a little bit better about the burn pits with burn pit vet registries. What I would say about the genetic piece of it is that we're trying to understand as a group whether or not certain genes put us at more risk, and then we have the environmental exposure. And so right now these two are happening in parallel, but as we learn more, particularly about the genetic piece of things, we'll likely start to overlay the environmental aspects on top of that. And so likely we're going to be able to have better understanding about, the accumulation of exposure based on genetics and based on environmental exposures that may be one or multiple, depending on somebody's career and what they've done in their career in the military. So we're learning, we're trying to figure all of this out. We appreciate everybody's help in terms of their participation, because these are the areas where we need to better understand what's happening with Parkinson's disease. And so everybody's involvement in this research helps us to better understand these questions.
Thank you. We'll take, I think, 2 or 3 more. I keep saying that, but these keep coming in. Gretchen, we have someone here who was diagnosed as an active reservist, and they're still trying to get medical retirement. Should they also be getting evaluated by the VA at the same time?
I would say yes. I have had veterans who have gone through it at the same time, where they're retiring, going through the retirement process, and they were being seen at the VA as well. I'm not 100% sure. I will be honest, and that's not my area of expertise. Usually our veterans have been, that I see, have been enrolled in the VA for many years, or have been retired from the military for many years. So I would say it's worth a shot to inquire with your local VA medical center to see if that is possible to get the process rolling at the same time. Dr. Hohler, you may know something else.
Having been through this myself,
right.
So oftentimes you want to start both processes going in parallel, oftentimes because there is a little bit of time that it takes for both, and usually the same medical records that are used for one are being used for another. So I think that individuals who, when I was a military physician, this is something that I helped people with all the time. And so having your records squared away and making sure that you're sending them to the right places and getting them started at the same time, you can do that. You can get that process started. So I encourage people to do that.
Awesome, thank you. And I believe this is our last question here. Looks like for Dr. Hohler, can exposure to any environmental factors, including Agent Orange, create a DNA change that can be passed on to veterans' children? Got a lot of people on the line who have children, it seems, and they're very worried about what that might look like.
So this is a very interesting question, and there's a lot of research being done right now looking at what impacts our DNA. And so how can our DNA be changed either by trauma or by exposures potentially to be able to then have a downstream impact on our future generations. So this research is really in its infancy right now. And some of the work that I've seen presented on this has more to do with trauma, so physical trauma and this type of trauma, and how it may actually impact genetics. It is conceivable, therefore, that environmental toxins could potentially produce some genetic effect. We know they're producing potentially a neurotoxic immediate effect, And looking at things like forever chemicals, for example, if they're staying with us forever and we are, potentially having children while we have forever chemicals in our body, does that impact future generations? I think it's an area for future study. I think it's an important area for us to understand in terms of the long-term effect on our future generations. So there isn't a lot of data on it yet, but it is an area that's being actively looked into.
Thank you. And I do want to provide an opportunity for both of you today to share any parting thoughts or last words with our audience members. I thank you so much for being here. I want to be able to give you an opportunity to share a parting sentiment.
Gretchen, I'll let you go first.
Okay. I just want to thank the Parkinson's Foundation for having me here and taking on this initiative to really get out to our veteran population to make them aware of the services that are available within the VA system and the benefits, and to Dr. Hohler for your expertise and the service to our country as well, for everything that you do for our veterans. And I just really encourage people to, we're here to support our veterans. Reach out to us. You have our information, our website, our phone number, any way that we can help with trying to connect you or at least guide you through the process. We're happy to do that. And we're just here to try to make sure our veterans get access to as much care as they can.
And I want to echo what Gretchen has said, and then also to expand to say, even if you aren't a vet with Parkinson's disease, if you have Parkinson's disease and aren't a vet, or have a loved one or a friend who's a vet with Parkinson's, this takes all of us in terms of working on these topics. And the more people that we can get involved in these types of initiatives, this research, this advocacy, the more likely we're going to have questions answered, the more likely we're going to be able to support our vets and their families, and the more likely we're going to have some further answers as we move forward to help our vets, their families, and also future generations. So all of this has a huge impact. We appreciate everybody's participation today. We're excited about this partnership with Parkinson's Foundation and the vets. We're looking forward to future studies, future information, future outreach for all of you as well. Thank you very much. And again, thank you for your service.
Thank you.
Awesome. Well, thank you both so much. And we will share a few parting slides here. That Q&A segment does conclude our presentation. And on behalf of the Parkinson's Foundation, I want to thank our fantastic speakers, Dr. Hohler and Dr. Vaou of St. Elizabeth's Medical Center, for their collaboration in delivering this program. And of course, Gretchen Glenn, for lending your expertise to our Q&A session. We are so glad you were able to join us. And of course, a very special thank you to each of you for joining us today and for your service for our veterans on the call. Today's program was recorded, and a link to the video will be emailed to you in about a week's time. And then the resources and links for most everything we mentioned today will also be included in that email along with the video. And if your question was not answered, we tried to get through as many as we could, but I acknowledge you had some really great questions there. Or if you're in need of any support, please do call our helpline at 1-800-4PD-INFO, or refer to the FAQ guide. You might find your answer there as well at parkinson.org/veterans. We hope that each of you will reach out to the VA and the Parkinson's Foundation for support, resources, and guidance on your Parkinson's journey. And last but not least, we hope that you'll stay tuned for other information, upcoming programs, including our Care Partner Town Hall on November 17th. It'll be focused on caregiving benefits and resources available through the VA, as well as our PD Health at Home programming. And before you go, don't close out just yet. Immediately following the program, a survey will pop up on your screen. So if you can just take a moment to complete that evaluation, we'll know how to improve our other programs in the future to better serve you. And your feedback is so important to us. In closing, thank you for your participation today, and thank you for your service to our country. We hope to see you again soon. Bye, everyone.